So, interestingly enough, I had recently done a review of an article in the New England Journal on vitamin C in patients with severe sepsis. And now there is a meta analysis of all of the studies on that topic. And the results are basically the same, is that low certainty evidence, the low quality studies that had been done, suggested that there was a reduction in mortality. These effects were attenuated when they limited the trials to blinded trials at low risk of bias. So when they analyzed the studies that had been done and only considered the studies that were at low risk of bias, then the confidence interval crossed 1 and there was no sign of benefit. For 90-day mortality, all trials had a low risk of bias. Moderate certainty evidence suggested harm. Now, the confidence interval still crosses 1, so minimal concern. Moderate certainty evidence suggested increased risk of hypoglycemia. That's a bit spurious. Vitamin C actually can affect glucometers and give a falsely low reading of blood sugar, but no credible subgroup effects were observed for mortality related to co-interventions. So certainly there is no benefit in vitamin C. And I don't want to go through this whole study again. It ultimately says the same thing as that New England Journal says, is that there's a possibility of harm and there is almost certainly no benefit. But something I didn't get a chance to talk about in that video was the fact that we think of vitamin C as being so benign. We think of vitamin C as something that, well, it couldn't possibly cause harm, and yet the moderate certainty evidence did suggest a trend towards harm. Now, maybe we need bigger studies to detect that harm. Maybe there isn't really any harm. Again, the confidence interval was not certain. But I guess it makes me really rethink the idea of benign interventions. When we don't have evidence, sometimes we guess. I myself, as I talked about in the other video, have given vitamin C before this evidence came out, but I was likewise in the camp of, well, it can't hurt, right? But what if it does? I think, in this group, there was no significant difference, and even the conclusion says there's no survival benefit. It doesn't really harp on the idea of harm the way the New England Journal article did, but it really does make me think that maybe the things we consider so benign are not. I mean, there's that study, which I'll link in the description below, that showed an increased risk of mortality with vitamin E supplementation. I think in general, we need to be very careful about the idea of supplementation. Things that we think are benign or couldn't possibly hurt, when we actually study them in a meaningful way, even vitamin C, vitamin E, may actually be harmful. They may not be neutral. And that, I think, is something we really need to keep in mind whenever we're talking about even vitamins or something that we think is trivial or must be helpful. I think, I take my multivitamin. Well, multivitamins have never been shown, and multiple trials have been done, and multivitamins have never been shown to provide any benefit, and several of the contents have been shown to do harm. So I think we need to think about the idea of supplementation very, very carefully and in a very different way than the general perception of these interventions. And they are interventions, but we need to think about them differently than the way our general cultural understanding of these interventions would push us to believe.